Now we'll have Dr. John Salmanton-Garcia. His PhD in health science by the University of Cologne. He's a postdoctoral researcher and project manager in the group of Professor Dr. Oliver Corneli, the Department of Internal Medicine at the University of Hospital of Cologne. Currently, he's a member of the coordination office of the VACCELERATE Consortium. It's a pan-European clinical research network for the coordination and conduction of COVID-19 vaccine trials. He's also working in the epidemiology of the COVID-19 infection in patients with hematological malignancies. So now is the time of John Salmanton. Thank you.
Thank you very much. First of all, thank you very much, Jordi, for your kind invitation to be here today to present VACCELERATE on my behalf and also on behalf of the whole VACCELERATE consortium. So VACCELERATE, it's a European platform for corona vaccine trial acceleration. It's, to the best of our knowledge, the largest clinical research network for COVID-19 vaccine trials in the whole Europe, and it's composed by 29 partners in 18 different EU member states and 5 EU associated countries. We received an initial funding of 12 million euros, and after the recommendation of the European Commission, we applied for a top-up funding of 14.5 million euros for performing our own clinical trials, 3 in total. VACCELERATE is currently part of the European Commission's pandemic preparedness policy. In this slide, we can observe how was VACCELERATE started. It started in September 2020 with the UBAP registry. UBAP is an online registry for clinical trials willing to perform clinical trials on COVID-19 vaccines. It's funded by the Federal Ministry of Education and Research of the German government, and it was started in September 2020. After 1 month, more than 100 sites had registered from the whole Europe, and in this very moment, the European Commission put their eyes on the whole project. We started in the end of October 2020, developing the idea of a volunteer registry for the whole Germany, and it was already set 15 days later, in November 2020. By December 2020, we submitted the expression of interest to the European Commission, and in the same month, we already had, after only 1 month, more than 10,000 registered volunteers in the German volunteer registry. In less than 2 months, we managed from the coordination office to perform and to submit a full proposal for the VACCELERATE consortium. The grant agreement was signed in February 2021, and then we submitted our first amendment in July 2021, and this is because, according to the suggestion of the European Commission, we modified the initial proposal so we could perform our own clinical trials. In September 2021, after 1 year since UBAP started, we had already 470 registered sites from different European countries. 1 month later, in October 2021, we had signed the first amendment, and in November 2021, last month, we started recruiting the first patient for our first of 3 clinical trials. These days, currently, the volunteer registry has been expanded to 10 countries, but I won't speak about this because the Dr. Pana will do it afterwards. These are the 7 VACCELERATE objectives. platform building, capacity mapping, capacity building, volunteer registries, laboratory access and assay standardization, solutions for vaccine development issues, and development and conduct of academically driven phase 2 and phase 3 clinical trials. In these slides, we can observe the different measures necessary to achieve the VACCELERATE objectives. In the lower part, we have the different work packages, a total of 11, and here we have the 4 measures: pandemic preparedness, vaccine trial design, vaccine trial conduct, and vaccine trial infrastructure. In the map, we can observe how is the current distribution of the registered sites in UBAP. They are registered from a total of 39 countries, and of the 470 sites, all of them colored in green, at least 380 are willing to perform clinical trials in adult patients. And 230, they are interested at least in performing clinical trials in pediatric population. I mentioned that we did an amendment, the first amendment, in order to include our own vaccine clinical trials. We did a total of 3, or we designed a total of 3 clinical trials, 2 for adults, the ones in the left, and 1 for pediatric population. The clinical trials for adults are divided in 2 different targets. The first one is targeting adult patients in elderly with more than or older than 75 years old that have already been vaccinated with an homologous scheme. The second one, it's sponsored by the University of Cologne in Germany. The second one, the EU COVID-2 booster vac, it's sponsored by the University College Dublin in Ireland. And here the target population are adults in general over 18 years old. And we will analyze also how does it work, the third or the second boost after an homologous vaccination. And the last one, it's the COVAC study sponsored by the University Medical Center Utrecht in the Netherlands. And we are looking for patients. Our target populations are patients, pediatric patients with or without prior SARS-CoV-2 infection. I would like to finish presenting you and introducing you the VACCELERATE Coordination Board. You might know some people appearing in here. For example, Jesus Frias, he's the work package leader. The work package leader, and also Pana, she will speak just after me. And also the VACCELERATE national coordinators. We can see that the national coordinator for Spain is Jordi, and also we can observe in the map how is the expansion of the whole VACCELERATE consortium. Thank you very much. I hope you have a nice time. Bye.
Thank you. Do you have any question? No? So now it will be Pana that will continue the presentation about the VACCELERATE European Corona Vaccine Trial. Thank you.
Thank you very much. Dear esteemed colleagues, ladies and gentlemen, dear students, good afternoon. First of all, I would like also to thank Jordi and his team for this excellent meeting. And it's a really great pleasure because actually we have been working for more than a year with Zizus, Zon, Paula, Jordi, but it's the first time that we meet in person. And we will discuss about our common goals. Is it? Okay. So I have been hearing during the session a lot about COVID-19 pandemic. I feel I can.
Better.
Sorry. Now it's better for me. So I have been hearing the session today, and I was thinking that after 2 years of this crisis, I think that we as the scientific community here in Europe, we need to reassess our priorities. And definitely what I realize is that we need to focus on accelerated knowledge through accelerated processes. Maybe we need also to regard this COVID-19 pandemic as an opportunity for improvement through coordinated actions. And I think that VACCELERATE, and specifically the Volunteers Registry, is an initiative that is trying to focus on that. If we go one step backwards and we try and see what are actually the lessons learned, at least until now, from COVID-19 pandemic, I think that we all agree, and based also on what we just heard from several scientists, is that COVID-19 pandemic has highlighted the need for dynamic, coordinated, and strategic emergency preparedness plan, not only for COVID-19 pandemic, but for any forthcoming epidemic or pandemics. The second issue is that probably this pandemic is only one example of future risks that we might encounter in the context of behavioral and climatic changes in this globalized world. And at last, I feel like that sometimes it's more or less our ethical duty as the European scientific community to try to establish, but also evolve the existing structures among the member states. So if we summarize, we all agree that we need to build on the European response on COVID-19 by creating, maintaining, strengthening the public health capacity, focusing on several aspects related to the pandemic, but more importantly on vaccine development and assessment. And of course, at last, these plans should focus on inclusiveness and access to all citizens, including children and underserved minorities. And as John said, we feel like in our network that VACCELERATE has an added value, is important currently, not only for this pandemic. So it's actually the first pan-European structure providing a single entry point, and maybe this is also the key word, a single entry point trying to interconnect, to foster interconnectivity among all European stakeholders that are involved in vaccine development. And this can be done under one roof, VACCELERATE, which is actually an excellence platform in order to improve the clinical trial, clinical trial performance. And I won't go in more detail because actually John has already mentioned our pillars. I would like to inform you, familiarize you with our vision regarding the volunteer access to the registry, to the VACCELERATE registry. So what is our vision? You can see that we are a group, the Work Package 10 group, with 9 institutions representing 9 countries. But we have a lot of collaborations and from other countries and institutions. And our vision is summarized mainly on 3 pillars. First of all, capacity building. So we are trying to implement a dynamic, harmonized, and most importantly, sustainable volunteer registry around the European region. The second thing is to foster inclusiveness and access. As I said, we would like to expand our registry, not only for healthy individuals, both adults and pediatrics, but we would like to expand also to patient advocacy groups and other minorities in Europe. And at last, again, the keyword, single entry point. It's very important to have coordinated actions among the member states and also in associated countries with Europe, and actually to increase our capacity and to enroll a high number of participants, both at the local, maybe national, but also simultaneously at a pan-European level in a short period of time. And this is actually our initial site and the link. As you can see, we welcome all European citizens, irrespectively of their vaccination status, irrespectively of their prior exposure to SARS-CoV-2, because all data, as you can see, are important. So we welcome all European citizens to register. And actually, we are trying to mobilize potential volunteers that would like to participate in forthcoming future clinical trials related to COVID-19 pandemic. And of course, this is only an initial interest. They express an initial interest. They're not obliged to participate in clinical trials or clinical studies. They just express an initial interest. And of course, as you can see also, this site is translated in several languages. And if you click on these languages, you will have a small questionnaire. And you need just to complete this questionnaire in order to be registered as a potential volunteer or participant in the VACCELERATE Volunteer Registry. And what is actually the added value of having the VACCELERATE Volunteer Registry? It's actually currently the only transnational volunteer registry in the European Union. The data that are collected are, of course, demographics, the distance that the volunteers are willing to travel until a potential clinical trial site, maybe from the EU websites, as Zon said. Pre-existing illnesses and comorbidities, we said that we would like to expand and include patients, patient advocacy groups, and of course, information related to COVID-19 as knowledge of prior COVID-19 infection and COVID-19 vaccination status. And definitely, all participants need to provide a consent form, and particularly for the pediatrics, this consent form, of course, is provided by the respective legal tutors. And the process of the VACCELERATE registration is, as you can understand, very easy. As I said, you all need to complete a questionnaire, 5 minutes. You just express your initial interest. And then this is the process of what can happen. So actually, as we said, we want to foster interconnectivity. So when we have a clinical trial and our clinical sites, we will go back to these volunteers and ask them, based on the criteria that we would like to follow, if they're interested to participate in this specific clinical trial. And then we actually interconnect the volunteers with the clinical sites. Again, we foster interconnectivity, we foster accelerated and coordinated processes. And this is the current activation status of the VACCELERATE Volunteer Registry. And at that stage, I need to sincerely thank Zon, who is a member of the coordination office, because actually from the beginning, he had personal meetings with each national coordinator, explaining the process, asking for the translation of the questionnaire, providing continuous help and support for the local bioethics approval process. So this starts with a meeting, and then of course all national coordinators, we are meeting regularly in order to ask any questions or actually address any problems that we have encountered with the whole process of approval. And as you can see here on the map, in a period shorter than 1 year, we have currently more than 35,000 volunteers around the European region. Of course, the majority of the volunteers are from Germany, but we do hope and we do think that if we disseminate or promote the volunteers registry correctly, then we will increase the number of volunteers in all participating countries in the whole European region. And as Sean said, currently we have 10 activated registries that represent actually member states, countries, but we expand beyond the member states. We have, as you can see on the slides, also countries that are closely associated with Europe, and we continuously expand our registries. In addition to that, we also collaborate with the existing registries in Europe, like for example in France. And what are our next steps? Of course, we need to evolve, we need to learn more about that because it's pretty much innovative for Europe, but definitely we need to disseminate our material, our promotional material, and we would like your support as scientific community in order to get the correct messages with regards to the aims and the vision of the Pan-European Volunteers Registry. So the tools that we have already finalized will be disseminated publicly, of course, mainly through through the scientific European community. The second step is that we would like, as I said, to improve our access and engagement in specific groups, mainly patient advocacy groups. So our next step is to make a questionnaire and try to see the perspective of the patient advocacy groups with regards to participant and volunteer registries. Are there any steps that we need to improve? We need to have a constant feedback with them. So this is the next step that we will do. And thirdly, we would like to increase, and this is, I think, the most difficult part, the vaccine clinical trial awareness and education among the public community. So we are trying actually to evolve some educational material. We have some interactive educational cards with 3D codes. We are preparing educational videos both for adults and pediatrics, and we are under a continuous process of evolving. Maybe in the following months, we can also evolve a video game that is related to these issues. And here is actually, for the first time, the drafts actually of some of these promo materials. You can see a flyer, which is actually intended to be given both electronically via social media, but also as hard copies, maybe through the national coordinators, through our local ambassadors, which actually explains what is the Volunteers Registry, our vision, our aims, process of registration. And then you can see also part of our educational cards, puzzles and toolkits that we are trying, as I said, to evolve currently. And we need also a slogan, and we have contacted with our communication managers, also from the coordination office, from EVI, from several organizations, and we feel like that we need to actually foster solidarity, foster collaboration, and community engagement. So the slogan is that we can be the missing piece. Each one of us, as European citizens, can be part of this pan-European effort, can participate and become a volunteer. So be the missing piece will be our slogan. And at last, this is, let's say, just an initial discussion and thought, and it was discussed actually very few days ago with the coordinator, with Professor Corneli. As I said, we have 35 volunteers currently. Most of them are vaccinated, few of them are unvaccinated, and the situation is evolving very quickly. So we all know as scientists that apart from clinical trials, phase 2, phase 3 clinical trials, we do need also real-world data, phase 4, vaccine effectiveness data, and maybe our common effort through the Volunteers Registry could also contribute and help on having quickly and in a standardized manner this information about vaccine effectiveness. So there has been some discussion, initial discussion, if we could actually transform this registry, this evolving registry, into a cohort, a longitudinal cohort, and maybe to ask all these volunteers if they would like to participate and have at specific time points some lab tests. So this is actually a vision. We are not sure if we can manage to do that, but apart from all the pure scientific, let's say, knowledge, I feel like that it's very important to make the citizens be part of any effort that we currently have during or even after the COVID-19 pandemic. And I would like to close again with the National Coordinators Group, because I feel like that it's a very important group, because we are actually the local liaisons and ambassadors. We are trying to interconnect all this scientific knowledge. Jesus Frias, our friend, told us about the clinical trials and the precious work that has been done. But we need to interconnect also with public authorities, with public organizations. So we need to interconnect all this knowledge also with decision makers. And we feel like that this group might play an important role in order to do so also in the future. And with that, I would like to thank you very much for the invitation today. Muchas gracias.